Thank you so much for joining us, Adesty. We are here to talk about COVID right now in residential shelters and children's homes.
Hi, good morning, everyone. I'm Adesty Dulawan. I'm the Clinical Supervisor of World Group International here in the Philippines. So we've been working with vulnerable children in residential facilities here and the same as vulnerable children in the communities here in the Philippines.
How do you actually begin to talk to them about COVID? You've got this virus out there, you have all of this information out there. What do you tell children, especially ones who are already dealing with so much?
First thing is they need to establish that the children are predisposed to listen. So that is by checking if they are emotionally, stable to listen, so that the chances that they're going to grasp the information that is going to be shared to them is really high. And then the manner of giving the information should be child-friendly. It should be simple in a language that is appropriate to the developmental level of the children, and as much as possible, concise and easily understandable. In delivering that, like the staff in the residential facilities, or even those doing in community activities dealing with children, can do that by first covering the scientific information about COVID, such as saying that COVID is a disease that is new. It is caused by a new germ or a new bug. And then, as I mentioned earlier, it's important to explain to them that given that there is COVID-19, there are expected emotional responses, such as they could experience fear, worry, anxiety, or sadness, and all of these are just but normal. And that there can be physical reactions as well, such as difficulty sleeping, jittery, agitated. They can also be irritable, and that all of those are also normal reactions to a pandemic situation. And then, of course, the very important aspect is, since this is something that is very uncertain, it's also important in explaining COVID to end it with the things that they have control over, such as even if it's a virus that we cannot see, there are actually things that we can do to, to not get sick. There are still things in our hands that we can do.
Well, thank you so much.